there's a lot that sets the Mish Institute apart from other training programs, either of the past or presently today. One based on science, one based on Dr. Mish in and of himself. This man lives, eats, breathes implant dentistry. It is his passion, to say the least. I've known Carl for over 15 years. I've been involved with the Institute for that length of time already, and there is no one else like him. I really thought of Carl when I first met him as the Bill Gates of implant dentistry, because it's his passion, to say the least. And there's nothing else that he's concerned about except elevating the standard of care. And with people like myself and other faculty, I've seen it develop and grow over the last 15 years that I've been involved with the Institute. And I've seen the changes of doctors that have come through the Institute, how it's affected their practice. Whether it's one case a month that they know that they can treat with confidence and treatment plan and execute the treatment and have a good success rate, or if they're doing it on a daily basis, that they don't have the complications and problems that existed for many of us as we were muddling through 25 years ago for some of us that we have today. Tremendous varieties of different program options that doctors can go through. There's a series of 3 programs from the restorative standpoint. There's a series of about 6 programs from the surgical standpoint. Each are 3 days in duration, and yet the faculty and Dr. Mish are available almost effectively 24/7 to help answer questions, as well as doing things online for the doctors after the program is over. So it's not as if we're not available after the fact. We're really there for them as long as we're alive, basically. I've told them that myself. There's a hands-on portion, both in laboratory phases of treatment from the restorative and the surgical portion, as well as doing live surgical treatment on their own patients through our connections with Temple University in Philadelphia, Pennsylvania, which is a tremendous learning experience. You can hear it, you can see it, you got to touch it. You got to do it like anything else and do it right before you develop bad habits, in essence. And that's what the Institute strives to achieve. And I've just seen a tremendous difference for ourselves as faculty, how the doctors have grown, and the feedback from the doctors. When I went to dental school, which was more than 25 years ago, implant dentistry was being done at that time primarily by the crazy guy down the street. And today it has become a standard of treatment for the majority of patients. At least a standard with respect to the option of knowing what's available. Doesn't mean every patient's going to go through with treatment with respect to implants, but certainly the option should be presented to the patient. And if you don't have any education, if it's just from reading a journal here and there, that's not enough to properly educate your patients along the way. And so going through the Institute, and there are a lot of doctors that have gone through the Institute that don't take the next step of treating patients on a routine basis, but at least they have the knowledge of what possibilities exist and perhaps who to refer them to. Whether it's other doctors that have gone through the program as a great referral source, or to people that are involved directly with the Institute itself, the faculty, or Dr. Mish, at least they know that there are options to help these patients. Certainly all of us can't treat every single patient. And there are those patients that I refer to other doctors who are better qualified, whether it's an implant therapy or other procedures that I don't do on a routine basis. The bottom line is what's best for the patient. And if I can't give them all the options available, then I'm not doing my job. If I don't know those options, I can't present it. And so that's really why coming through the Institute, even if it's just 1 or 2 of the programs, it doesn't have to be every program necessarily, will give the doctor coming through a better understanding of what is potentially available out there to then refer accordingly if he or she is not going to treat the patient themselves.